The next time you're planning on lifting something, pay attention to how you're doing it. One wrong turn and you could be stuck with low back pain. Dr. Gill with the Gill Center for Back, Neck, and Chronic Pain is talking to Christy Hafner about treatment options.
Well, we are talking low back pain with Dr. Gill, and it's shocking how common it is.
Yes, in fact, 80% of the population will suffer with lower back pain at some point in their life and actually lose work because of it. And it's, the second leading cause of lost work time, only followed by the common cold. The statistics are amazing. $100 billion is the cost for treatment of lower back pain here in the United States.
So you are going to show us how to properly lift something so that we aren't getting injured.
That's right. There's a lot of ways to take care of your back, but exercises is one. But let's talk about lifting and the proper way to lift. So you want to remember 4 S's when you lift properly.
Okay.
Remember to lift, keep the object snug, close to your body, lift slow, lift smooth, lift straight. So what all that means, here we have a box. You want to keep the object close to your body, so snug. Lift slow, lift smooth, not a jerky movement, and lift straight. Keep your back straight. So the proper way to lift is going to be to bend the knees, pick the object up, keep it close to your body, and lift with your legs, lift straight. The thing to really remember is don't bend and twist at the waist when lifting. So what I mean by that is the wrong way to lift would be like this. See how I'm twisting at the waist and then picking that up? Even if it only weighs a couple of pounds, bending and twisting causes a damaging force, a shearing force on the discs, and can over time tear the disc fibers, leading to a herniated or bulging disc. So you want to try to avoid that. And when you set it down the same way like you lifted it. If you have a stack of objects that you have to pick up and move to a different location, you want to use your feet as the pivot point and set it down, as opposed to twisting like this. See how I'm twisting it the way? Don't do that. That's the wrong way. Now, I also brought with me a back brace. And when you're lifting, it's best to wear a back brace, especially if you have low back problems. So you put the back brace on and you pull everything really tight just to give your back some extra support. And you'll be amazed at the difference it makes in supporting the low back and giving you some relief and support while lifting. So then you can go about lifting. You don't have to wear it on the outside. You can wear it underneath if you want to. It works well that way as well.
So if someone is experiencing low back pain, they didn't take heed of how to lift, what can you do for them?
Well, we have a number of different treatment options in our office that are non-invasive, non-surgical, very advanced technologies. One of those is spinal decompression therapy. And spinal decompression gently separates the vertebrae. It creates a negative pressure, sort of a vacuum type of effect that allows the fluids around the tissue to diffuse and re-enter the disc to promote healing in a natural, non-invasive way. Great for herniated discs, for bulging discs, very safe, very effective. Patients actually fall asleep during the treatment. Another treatment for back pain is chiropractic adjustments. And we do that with great success with many patients with all kinds of different back and neck problems. We also have a class 4 laser that we use. And the laser uses light energy. There's actually photoreceptors or light receptors in the cells that when those light receptors are triggered, it actually helps the healing process, decreases swelling and pain. And then when patients have progressed and they're actually doing a lot better, we start MedX, which is advanced technology in exercise rehabilitation. We start them on MedX rehabilitation exercises. Those MedX machines keep them from cheating and using their legs and buttock muscles, forcing them to use, the patients to use their back and really strengthen the deep muscles involved in keeping the posture erect and keeping the back safe.
Now, Dr. Gill, you have a special offer for our viewers.
That's right. We have a very special offer. The first 25 callers will receive an examination, x-rays, the reported findings, and their first treatment, all for $79. The number to call is 794-0800, 794-0800, and you'll get that special opportunity.
The Gill Center for Back, Neck, and Chronic Pain is located at 209 South Royal Oaks Boulevard in the Watson Glen Center out in Franklin. To book an appointment, give them a call at 615-794-0800. Again, that's 615-794-0800. Or you can log on to betternashville.com for a link to their website.